Imagine starting a new journey toward feeling better, hoping for immediate relief, but instead, you find yourself facing even more discomfort at first. This can be a confusing experience, especially when dealing with something as challenging as obsessive-compulsive disorder. For many people, yes, feeling worse during the initial stages of obsessive-compulsive disorder, or OCD, treatment can indeed be a normal and even expected part of the process. This temporary increase in anxiety or distress is often a sign that the treatment is actually starting to work effectively. The primary reason for this initial worsening lies in the nature of effective OCD therapy, particularly exposure and response prevention, commonly known as ERP and ERP. You gradually and safely confront the thoughts, situations, or objects that trigger your obsessions and compulsions. By intentionally exposing yourself to these triggers without performing your usual rituals or avoidance behaviors, you are directly challenging your brain's learned fear responses. This confrontation naturally brings about anxiety and discomfort because you are actively breaking old patterns and learning new ways to respond to your fears. It is an active process of emotional relearning, also known as habituation or extinction learning. Understanding this process can help you manage these difficult moments. It is important to communicate openly with your therapist about how you are feeling. They can help you differentiate between therapeutic discomfort, which is productive, and distress that might indicate your treatment plan needs adjustment. Keep a journal of your experiences and feelings during sessions and between appointments to provide your therapist with a clearer picture of your progress and challenges. Sometimes, during this process of breaking old patterns, you might experience what is called an extinction burst. This is a temporary flare-up of symptoms where the OCD might feel more intense or bothersome than usual, almost as if it is trying one less desperate attempt to regain control. Recognizing this as a sign that your brain is actively working to unlearn the fear, rather than a sign of failure, can be incredibly empowering. This therapeutic discomfort is not a setback, but a crucial step forward in establishing new, healthier responses. Ultimately, experiencing a temporary increase in distress during OCD treatment, especially with exposure and response prevention, is a common and often positive indicator. It means you are confronting your fears head-on, allowing your brain to habituate to anxiety without resorting to compulsions. This challenging period lays the groundwork for lasting relief, helping you reclaim your time and energy from OCD and build a life that is truly aligned with your values.